The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC. And one of the interesting issues that's arisen recently in cardiology is the concept that aortic stenosis is really an active disease involving inflammation. And a very interesting paper that we have in press deals with that very issue where positron emission tomography is utilized to image the aortic valve, and in patients with aortic stenosis demonstrate evidence of fluorodeoxyglucose uptake, presumably due to inflammation. And I'm talking to the senior editor of that paper, Dr. Ahmad Tawakkal, who's assistant professor of medicine at Harvard and the co-director of the MRCT PET imaging program at the Massachusetts General Hospital. So, Ahmad, perhaps you could describe your findings to us.
We performed PET and CT imaging on 82 patients who underwent echocardiography to evaluate their valves. And we specifically wanted to compare patients with aortic stenosis versus patients without, who are age and gender matched, and looked at the FDG uptake, a marker of inflammation, within the center of the aortic valve process. And what we found is, first, that patients with aortic stenosis had a higher degree of FDG uptake in the valve apparatus, suggesting that they had more inflammation, consistent with the findings in animal studies, as well as pathological series. We also looked at the relationship between FDG uptake and various degrees of aortic stenosis severity. And we found that there was a relatively high degree of uptake in mild and moderate aortic stenosis, and then the activity fell off substantially in severe aortic stenosis, suggesting to us that there was a burnt-out phase of the inflammatory stage of disease. In a small group of patients, we were also asked to look at the relationship between the initial FDG uptake and subsequent behavior of the valve over a 2-year follow-up period, and we found that the patients with the highest FDG uptake were substantially more likely to have progression of aortic stenosis compared to the patients with lower FDG uptake.
Now, presumably, Ahmad, these are patients who already have evidence of aortic stenosis, some degree of gradient across the aortic valve. At an earlier point in time, do you think you'd find the same results?
You know, that's an interesting question that you raise. We clearly see a wide spectrum of FDG uptake in patients with so-called normal valves, and there is a substantial overlap with those with mild aortic stenosis. And while that could simply be a problem with our imaging approach, that is not sensitive enough to differentiate, it could also imply to us that a subset of patients with normal valves have increased activity that one day might lead to aortic sclerosis and afterwards stenotic activity.
Interesting. So I guess there's some potential therapeutic implications here regarding perhaps anti-inflammatory agents or statins.
And that is really what we're most interested in. Eventually, we'd like to see, first, can we predict aortic stenosis progression in patients with sclerosis or mild aortic stenosis, for example? And secondly, are there novel therapeutics that we could try to target the process to modulate rather than simply observe the natural history of the disease? So anti-inflammatory therapies certainly would be of great interest. Obviously, there's been substantial disappointment around the statin studies, most of which, at least the prospective randomized studies, have been done on patients without elevated cholesterols. So it could be conceivable to re-examine the statin hypothesis on aortic stenosis simply on patients with demonstrated activity on their valves. And it could also be feasible to look at completely different modulatory approaches, novel therapeutics that we haven't really discussed.
Obviously, aortic stenosis is the valvular disease of our generation, and these data are really fascinating. I love the idea that it's the best use of imaging in studying the pathophysiology of a process, and PET may provide us a technique to identify these patients with AS in whom we could alter progression. Thanks very much for being with us. For Inside JACC, I'm Tony DeMaria.